diving into the world of psychological disorders today, how they influence behavior, how we can treat them. This is really important stuff, especially for anyone on the pre-med track or prepping for the MCAT.
Yeah, that's right. If you're looking to get into medicine, understanding mental health and its biological basis, it's just fundamental.
Right, and we'll be exploring a whole range of disorders, always looking at, how they manifest in behavior and how we can intervene to make things better.
Absolutely. I think that's a great starting point.
Okay, so let's get down to the basics. What exactly is a psychological disorder? I mean, how do we define it?
Well, at its core, a psychological disorder is a pattern. It's like a recurring pattern of thoughts, feelings, behaviors that really cause significant distress or impair someone's ability to function in their daily life. It's got to be something that really gets in the way.
Okay, so it's not just like feeling a little down every now and then. It's got to be something pretty disruptive.
Exactly. And when we think about where these patterns come from, right? The older view, it was very much focused on just biological factors, things like your genes or the chemistry in your brain. But the more complete picture, the one we really use today, is this thing called the biopsychosocial model.
Okay, so it's more than just a chemical imbalance like we used to hear about all the time.
Yeah, way more. It's really taking into account the interplay of biological factors, psychological factors, like how you cope with stress, and even social factors like your environment and your relationships. It's all connected.
So someone might be predisposed to a certain disorder genetically, but it might never actually fully develop unless they go through some sort of major stressor in their life, like a traumatic event or something.
That's exactly right. And that really highlights how important it is to look at the whole picture. All these factors together, it's not just one thing.
Can you give us an example of how these different factors might kind of come together in a real world scenario?
Sure. Imagine someone with a family history of depression, right? So that's the biological piece. Now, let's say they go through a difficult divorce and lose their job at the same time. Those are big psychological and social stressors.
Yeah, definitely.
Now, that combination, it could very well trigger a depressive episode in that person. The vulnerability might be there from the genes, but those life events act as a catalyst.
Makes sense. So we've got this understanding of what a disorder is and this kind of framework for thinking about where it comes from. But how do we actually classify all these different types of disorders?
Well, that's where this big book comes in. It's called the Diagnostic and Statistical Manual of Mental Disorders. We're on the 5th edition now, DSM-5. It's basically the standard reference that clinicians use to diagnose psychological disorders.
So it's kind of like a mental health encyclopedia, right?
Yeah, you could think of it that way.
Yeah.
It lists out specific criteria for each disorder and organizes them into broader categories.
Okay, so what are some of those main categories that pre-med students should definitely be familiar with, the ones they might see on the MCAT?
Right. So you'll definitely want to know about mood disorders, things like major depressive disorder, bipolar disorder. Then there's anxiety disorders, which include things like generalized anxiety disorder, social anxiety disorder. We've got psychotic disorders, with schizophrenia being a major one. And finally, personality disorders.
So things like borderline personality disorder, antisocial personality disorder, that kind of thing.
Exactly. Those are some of the big ones you're likely to encounter, both on the MCAT and in clinical practice.
And why is having this system of classifications so important, practically speaking?
Well, because it really guides treatment decisions. Different categories of disorders often respond best to different types of interventions.
Oh, I see. So it's not just about slapping a label on someone. It's actually about figuring out the best way to help them.
Exactly. Mood disorders might frequently involve medications like antidepressants. Anxiety disorders, on the other hand, might benefit significantly from therapy like CBT. And of course, very often the best approach is a combination of both, meds and therapy working together.
Okay, that makes sense. Let's dive into some of these categories then. Let's start with anxiety disorders, since you mentioned they're so common. From a biological perspective, what's actually happening in the brain when someone's experiencing all that excessive worry?
Well, with anxiety disorders, you're basically seeing an overactivity of the body's natural fight or flight response.
Right.
The one that kicks in when we sense danger.
Right.
But in anxiety disorders, this response gets triggered way too easily, even when there's no real threat. And a lot of this comes down to neurotransmitters, specifically norepinephrine and serotonin. They're key players in regulating anxiety.
So it's like the brain is sending out all these false alarms even when there's nothing to be afraid of.
Yeah, that's a good way to put it. So even though there's no real danger, the biological mechanisms that trigger those feelings of fear and worry are they're in overdrive.
Can you give us a more concrete example of how this might play out in someone's life?
Sure, think about a college student, right? Super anxious before every exam, even when they studied really hard and know the material.
Oh, yeah. I definitely knew a few people like that back in college.
Right, and it's not just the pressure of the exam. There might be a genetic predisposition that makes their stress response system more reactive. And maybe they've had some stressful experiences in the past that have kind of amplified that sensitivity.
So even though they're objectively prepared for the exam, their anxiety is still through the roof because of these underlying biological factors.
Exactly. And that's really important to understand because a lot of the medications we use to treat anxiety, they actually target these very neurotransmitter systems.
Okay, so how do we typically treat anxiety disorders given this biological component?
Well, as I mentioned, medication is often a part of the treatment plan. SSRIs, selective serotonin reuptake inhibitors, they're very commonly prescribed. They basically work by increasing the amount of serotonin available in the brain. And serotonin, as we said, plays a role in mood regulation.
Right.
Now, benzodiazepines, those are another class of medications that can provide quicker relief from anxiety, but they are usually used more cautiously because of the potential for dependence. And then on the therapy side, cognitive behavioral therapy, CBT, is super effective for anxiety.
Yeah, I've heard a lot about CBT. How does that work?
It basically helps people identify and challenge those negative thought patterns that are fueling their anxiety. So they learn to reframe their thinking and develop healthier coping mechanisms.
So it's like retraining your brain to react differently to stressful situations.
Yeah, that's a good way to think about it.
Okay. Let's move on to OCD, obsessive compulsive disorder. I think most people have heard of it, but it's often misunderstood. What's the biological story behind OCD?
Right. OCD is characterized by these obsessions, which are unwanted, intrusive thoughts, images, or urges that cause a lot of anxiety and distress.
So like constantly worrying that you left the stove on, even though you know you checked it like 100 times.
Exactly. And to alleviate that anxiety, people with OCD develop compulsions, which are repetitive behaviors or mental acts that they feel compelled to perform.
So like checking the stove over and over again.
Right. And biologically, research suggests that there's some dysregulation in the serotonergic and dopaminergic systems in people with OCD. And there's also some evidence that a part of the brain called the orbitofrontal cortex, which is involved in decision-making and impulse control, might be overactive in people with OCD.
So it's like their brain is stuck in this loop of like sensing a problem and then trying to fix it, but then the problem never really goes away.
Yeah, that's a good analogy. The obsessions trigger the anxiety, and the compulsions are an attempt to reduce that anxiety.
Yeah.
But unfortunately, they often end up reinforcing the cycle.
Do we know anything about what might cause that dysregulation in the brain?
It's likely a combination of factors. Genetics definitely play a role. There's also some evidence that environmental factors like childhood trauma or infections might contribute. But honestly, we're still learning a lot about the exact causes of OCD.
That makes sense. It's such a complex disorder. So how do we typically approach treatment for OCD?
Similar to anxiety disorders, the treatment often involves a combination of medication and therapy. SSRIs are frequently prescribed to target the serotonin system, and in some cases, antipsychotic medications might be added if there are other co-occurring conditions.
And what about therapy?
The gold standard for OCD is cognitive behavioral therapy, with a specific technique called exposure and response prevention, or ERP.
Okay, I've heard of exposure therapy. How does that work specifically for OCD?
Well, it involves gradually exposing the person to their obsessions, but without allowing them to engage in their compulsions.
So like if someone's afraid of germs, you'd have them touch something that they perceive as dirty and then not let them wash their hands immediately.
Exactly. It sounds counterintuitive, but the idea is to help them learn that the feared consequences don't actually happen. And over time, their anxiety naturally diminishes.
So they kind of like relearn how to react to their triggers.
Yeah, exactly. They learn that they can tolerate the anxiety without needing to perform the compulsion.
Fascinating. All right, let's switch gears now and talk about bipolar disorder. You know, the one with those extreme mood swings. What's the biological basis for those really intense highs and lows?
Right. Bipolar disorder is all about these really dramatic shifts in mood, energy, and even activity levels. They can range from periods of mania, which is like super high energy and excitement, to periods of deep depression.
And what's going on in the brain during these different phases?
Well, during mania, there's strong evidence that the dopamine system is overactive. Dopamine's a neurotransmitter that's involved in reward and pleasure, so when it's in overdrive, it can lead to that euphoric feeling, increased energy, and sometimes even risky behavior. Then, when someone's in a depressive episode, we often see deficiencies in serotonin and norepinephrine.
So it's not just one neurotransmitter being out of whack, it's kind of like a seesaw effect with multiple systems involved.
Yeah, exactly. And importantly, genetics play a huge role in bipolar disorder. There's a very strong familial pattern.
So if someone in your family has bipolar disorder, you're more likely to develop it yourself.
That's right. But of course, it's not a guarantee. Even if you have the genes, it doesn't mean you'll definitely develop the disorder. Other factors, like stress or trauma, can also contribute.
Can you describe what these different manic and depressive episodes might look like in someone's actual behavior? I mean, how do you actually tell if someone's experiencing one of these extremes?
Sure. So during a manic episode, you might see someone who's suddenly got tons of energy. They might be talking really fast, jumping from one idea to another, feeling super confident, even grandiose. They might sleep very little and still feel totally wired.
Like they're on fast forward.
Yep, exactly. And then in contrast, when that same person goes into a depressive episode, it's like everything slows down. They might have very little energy, have trouble concentrating, lose interest in things they used to enjoy. They might sleep a lot or have trouble sleeping at all, and they might feel hopeless and worthless.
So these aren't just like normal ups and downs that everyone experiences. These are really extreme and debilitating shifts in mood and behavior.
Absolutely. And that's why it's so important to seek professional help if you or someone you know is experiencing these kinds of symptoms.
Okay. So how do we typically manage bipolar disorder?
Well, because of those extreme mood swings, medication is usually the cornerstone of treatment. Mood stabilizers like lithium are often the first line of defense. Lithium has been shown to be very effective in preventing both manic and depressive episodes.
And how does lithium work?
We don't know the exact mechanism, but it seems to help regulate the activity of certain neurotransmitters involved in mood. Besides lithium, anticonvulsant medications are also used as mood stabilizers, and antipsychotics can be helpful during manic episodes to manage agitation and psychotic symptoms.
So medication is key, but is therapy also involved in treating bipolar disorder?
Absolutely. Therapy is extremely important alongside medication. Cognitive behavioral therapy, or CBT, can help people identify and manage their triggers, develop coping mechanisms, and improve their overall quality of life. And then there's a specific type of therapy called interpersonal and social rhythm therapy, or IPSRT, that focuses on establishing regular routines and sleep-wake cycles, which can be really helpful in stabilizing mood.
Okay, that makes a lot of sense. So it's kind of like a multi-pronged approach, targeting the biological factors with medication and the psychological and social factors with therapy.
Exactly. It's all about finding the right combination of treatments to help each individual manage their symptoms and live a fulfilling life.
Okay, let's move on to a disorder that can be really challenging to understand. Schizophrenia. It's a condition that really impacts how a person experiences reality. What's happening in the brain with schizophrenia?
So schizophrenia is a serious chronic brain disorder that affects a person's ability to think, feel, and behave clearly. And biologically, one of the main things we see is a problem with dopamine, a neurotransmitter, in certain brain pathways. It's often overactive in a pathway called the mesolimbic pathway, which is involved in reward and motivation.
So too much dopamine in the wrong places, essentially.
Yeah, you can think of it that way. And it's important to remember that it's not just about dopamine. Other neurotransmitters like glutamate are also involved, and we're still learning a lot about the complex interplay of brain chemicals in schizophrenia.
Right, right. And besides neurotransmitter imbalances, are there any other structural abnormalities in the brain that are associated with schizophrenia?
Yeah, some individuals with schizophrenia show structural differences in their brains. For example, enlarged ventricles, which are fluid-filled spaces in the brain, are sometimes observed. And these structural changes can be linked to cognitive impairments.
We often hear about positive and negative symptoms in the context of schizophrenia. Can you break down what those mean exactly?
Sure. So positive symptoms are basically things that are added to a person's experience that wouldn't normally be there. Things like hallucinations, which are sensory experiences that occur without any real external stimulus, like hearing voices when no one's speaking.
Right.
And then there are delusions, which are false beliefs that are held very strongly, even when there's evidence to the contrary, like believing that you have special powers or that someone is trying to harm you.
And those are considered positive symptoms because they're added experiences, not because they're good things.
Exactly. It's a bit of a confusing term, but that's the way it's used in this context. Now, negative symptoms, on the other hand, represent a decrease or absence of normal functions. So things like lack of motivation, reduced emotional expression, or difficulty speaking.
So it's like a loss of normal abilities and experiences rather than an addition of unusual ones.
That's right.
Can you give us an example of how both positive and negative symptoms might present in someone with schizophrenia?
Imagine someone who believes that their TV is sending them secret messages. That's a delusion, a positive symptom. And then they might also report hearing voices commenting on their actions, even though no one's there. That's a hallucination, another positive symptom. Now, at the same time, this person might also be very withdrawn and isolated. They might struggle to hold down a job or take care of themselves because they lack the motivation or energy. Those are negative symptoms.
So it's a combination of these unusual experiences and a decline in their ability to function normally.
Exactly. And that's what makes schizophrenia such a challenging disorder to live with, both for the individual and for their loved ones.
So how do we approach treatment for schizophrenia?
The main treatment is antipsychotic medications. They help to manage those positive symptoms by affecting dopamine activity in the brain. There are different types of antipsychotics, and they can have different side effects. So it's important to work with a psychiatrist to find the medication that works best for each individual.
And what about therapy? Does that play a role in treating schizophrenia?
Yeah, therapy is also a very important part of treatment. Cognitive behavioral therapy, or CBT, can help individuals with schizophrenia manage their symptoms, improve their social skills, and cope with the challenges of living with a disorder.
So like we've seen with other disorders, it's a combination of medication and therapy that's often most effective.
Absolutely. It's about addressing both the biological and the psychological aspects of the condition.
Okay, let's move on to our last category of disorders for today, dissociative disorders. We'll focus specifically on dissociative identity disorder, or DD, which is a complex condition often linked to trauma. What do we know about what's happening in the minds of individuals with DD?
So DD, which some people still refer to as multiple personality disorder, is a condition where a person has two or more distinct identities, or alters, that control their behavior at different times. And the prevailing theory is that it develops as a response to severe and prolonged trauma, often in childhood.
So it's like the mind creates these separate identities to cope with overwhelming experiences that are just too painful to process all at once.
Exactly. It's a way of compartmentalizing the trauma. And each alter might have its own unique characteristics, memories, and even behaviors. They might even have different names and ages.
That sounds incredibly difficult to live with. I mean, how do people with DID even function in daily life if they're constantly switching between different identities?
It can be very challenging. Some people with DID experience amnesia, or gaps in their memory, when another alter is in control. They might find themselves in unfamiliar places or situations without any recollection of how they got there. They might also feel detached from their body or their emotions, as if they're watching themselves from outside.
So they might feel like they're losing control of their own lives.
Yeah, that's a common experience, and it can be very frightening and confusing.
What are the typical treatment approaches for DID?
The primary treatment is long-term psychotherapy, and both psychodynamic therapy and CBT can be helpful. The goal of therapy is often to help the individual understand and integrate their different alters into a more cohesive sense of self.
So it's about helping them come to terms with their trauma and develop a unified sense of identity.
Exactly. It's a long and challenging process. But with the right support and treatment, people with DID can learn to manage their symptoms and live fulfilling lives.
And are medications ever used in treating DID?
Well, there aren't any medications specifically designed to treat a DID. But medications like antidepressants or anti-anxiety medications might be prescribed to manage associated symptoms like depression, anxiety, or sleep problems.
So it's more about addressing the underlying emotional and psychological issues that contribute to the dissociative symptoms.
Okay.
Well, we've covered a lot of ground today. We've gone from the basic models for understanding psychological disorders to the specific biological, psychological, and social factors involved in several key categories. And we've also discussed various treatment approaches. It's clear that these are complex conditions with a huge impact on individuals, families, and society as a whole.
Absolutely. And I think the key takeaway is that we need a comprehensive understanding of both the biological and psychosocial dynamics of these disorders to develop effective treatments.
Right. It's not just about fixing the brain. It's about supporting the whole person.
Exactly.
To our listeners, I hope this deep dive has given you a clear understanding of these important topics, especially for those of you studying for the MCAT or preparing for careers in medicine. And remember, as you continue your studies, approach these topics with both scientific curiosity and empathy.
Well said. It's such a vital area of study.
And that concludes this deep dive into psychological disorders. Thanks for joining us.
My pleasure.
Be sure to tune in to our next episode, where we'll be exploring the fascinating world of motivation, emotion, and stress, and how they influence our behavior. Until then, take care.